Listening to them as well, except for all of you. Dibs, you too. You're about to listen to the great stylings of one Dr. Nirav Pandya, because it is time for Cleared to Play, where we take you inside the tent, get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Associate Professor of Orthopedic Surgery, Dr. Nirav Pandya. Hey, Doc.
Good. How are you guys doing?
We are fantastic. We've both got nothing going on in the pelvic area, and so we're very, very excited about that. We cannot say that for Christian Pulisic. What did you see, and what do you say after that goal yesterday?
Well, first of all, I was extremely excited. One of the top U.S. goals in international play in a long time. But you see that injury, and obviously everyone's concerned about an injury to one of his more sensitive areas down there, and. The concern you obviously have when someone gets hit down there is there any other abdominal injury? Did he hurt a kidney? Did he hurt a liver? Did he hurt a spleen? Because that, those obviously organs are in that area. But now it just sounds basically like it's a bruise. He potentially bruised the bone, bruised some organs down there. It's really about pain control. Like, there's really no timeline for healing. So if he can be effective and they can control the pain, I anticipate he's going to be out there. There's really no limitations in terms of him playing on Saturday if the pain control's there.
From a musculature standpoint, is there anything that could be damaged in there? Is it a pulled groin? Is it something of that nature other than perhaps a broken pelvis? Is there anything tendon-wise or ligament or muscle-wise that could really be limiting?
Yeah, you do worry your groin muscles, your adductor muscles do attach up in the pelvic region. So if you do have a blow there, theoretically, if there's contusion where that tendon attaches to the pelvis, it could last a little bit longer. Typically with soccer players, we obviously see that happen with non-contact injuries. So the good news is that it's very painful. It typically doesn't impact function as much as when the muscle actually or tendon actually tears. But you do worry a little bit about a groin injury. So could it potentially impact him in terms of when he's kind of doing crossing passes or trying to kick? Potentially, but just seeing the way he was walking around the hotel in those videos, he seems like he's going to be all right.
Yeah, and of course, he sent out on social media, see you Saturday. He'll be ready to go. So that's all good news. We had a few weeks where we didn't have a whole lot to talk about after 49er games. Unfortunately, this week's not one of them. So let's talk about Elijah Mitchell. Not just that he's got the sprained MCL. We've had that conversation already this year. But the fact that there were two of them right back to back, what does this say with regard to the overall health of his knee?
I think he's, it's going to be okay. I mean, I think you get worried about, was it a non-contact injury where something's just basically like he's running out in the open field and his knee gives out. I think it was just bad luck. He had a play that probably would have injured his MCL a year ago or 2 years ago. So the good news about MCL injuries, even if they're, have one on each knee or it's a repeat injury, you still return to play, and there's no long-term issues with that. So he clearly demonstrated that he could play at a high level immediately from coming back. And luckily, there's still enough time left in the season, and as long as he heals well, he could be back for the playoffs. So I'm not concerned about long-term issues with his knees. He doesn't have any cartilage issue. He doesn't have any meniscus issues. MCLs heal pretty predictably. It just stinks for him that he's got this time off, and he came back for a couple of games and then clearly has to go out again. But he demonstrated that even with that 8-week, 9-week time off the first time, he came back at a very high level. So I think he'll be good to go for the playoffs, assuming he recovers well.
Less emergent, but maybe equally troubling, Christian McCaffrey with knee irritation. What is the medical diagnosis for this sort of a knee irritation and his ability to be able to play through it? We saw him doing some deep knee bends on the sideline. What do you make of his issue?
Yeah, it's quite a pretty vague diagnosis, and it does kind of concern me a little bit. You don't want to have a running back kind of carry that diagnosis, this kind of global knee irritation diagnosis. I think it really comes down to, is this irritation coming from something outside the knee? Is it a tendon? Is it more muscle-related? And then you get a little bit less worried about that because you can manage that with basically just managing how many carries you get and how you're using them in the offense. If there's some degree of irritation inside the joint, is there some sort of bone bruise? Is there some cartilage irritation? Then you get a little bit more worried about that because that can pop up and irritate him at any time. So I'm going to assume, because the diagnosis is more vague, this is probably something outside of the joint, and they can limit it by limiting how much load he carries. Problem with that, obviously, is with Mitchell being out and, obviously Debo not necessarily up to full speed yet based on how he's been used. You do get concerned of McCaffrey being overused, but hopefully they can manage it and it shouldn't be a thing. But something to watch. I'm a little bit concerned about it.
Yeah, it's interesting also, Doc. I mean, we've probably buried the lead. We're talking big names with Pulisic and McCaffrey, and so far we've left out the quarterback of the 49ers. What did you see on that play? And the team has come out and said he's sore, but he's fine. What are your thoughts when you saw Jimmy go down?
Yeah, so I was like, oh, he has to have an MCL injury. I mean, it looked just like, he had that blow, kind of the classic kind of look for that. And he got back up. I was like, that's a good sign. And you never want to see hits to a reconstructed knee. That was Jimmy's knee that he had his ACL surgery on, and it kind of said he was sore. I'm surprised there wasn't an MRI. Maybe he's just kind of feeling good. The thing you have to look for him is, how is his mobility going to be? Obviously, he's not the most mobile quarterback, but is he a little bit slower in terms of avoiding the rush? Is he not following through on his throws? I think a little bit of a silver lining, we talked a little bit about this last week. I think Whitey asked me this question was, could his shoulder rehab actually cause him to strengthen his lower extremities? And could the Garoppolo of 3 years ago have gotten that blow, actually have had a more severe MCL injury or actually torn his ACL? Perhaps what saved him may have been his shoulder because all that rehab he did. So I was very concerned when I saw that. He clearly got up, but those dirty hits will happen, and unfortunately, he got one, but he seems to be okay. It's just to watch, really something to watch this upcoming game as well too.
Speaking of watching Josh Allen, we've kind of had our eyes on Josh Allen's arm after the UCL injury. It seemed like the first week we were concerned about it, and since then it's kind of subsided. What have you seen from Josh Allen and his arm issues?
Absolutely. It seemed like it got better much more quickly than a lot of us expected. I think when everyone hears UCL, they think pitcher, Tommy John, end of career. I mean, with quarterbacks, you just don't need surgery on this. It's really about pain relief. The mechanism of throwing is different. The volume's different. So barring some sort of bizarre injury to him, this is clearly what you would expect, maybe a little bit quicker than the typical quarterback. But you get pain relief. You don't need that UCL for stability in throwing as a quarterback. So I think he's on that pathway to getting better. This is a recurrent issue for him, unfortunately. He had a UCL injury, I think, a couple of years ago as well, too. So something to watch for him if he gets anything potentially done in the offseason to address it. But I think he looks great, and this shows you why quarterbacks don't need Tommy John surgery. It's a pitcher issue.
Doc, Jonathan Kuminga played basketball last night, didn't he?
Oh, he did. And he's going to play basketball probably every night for the next couple nights.
Out of bed. Okay. Hey, Doc, thank you so much.
Absolutely. Anytime, guys.
All right, there he goes. It's Doc Pandya. The proceeding was sponsored by UCSF Health.